Hello, everybody. Welcome to this session for women suffering from ovarian cancer and those that support them. We will be talking about chemo brain and fatigue, and we were talking about these secondary effects that can have important consequences. Our speakers will be giving you important information on these secondary effects and what can be done to deal with them. And you will be able to ask questions at the end. My name is Denise Burns, and I'm the Regional Director for Quebec for Ovarian Cancer Canada. We hope that this session will be useful to you. So that we'll be hearing today about two different secondary effects of ovarian treatment. We have Madame Christine Leblanc, who is a registered nurse who works in oncology at the Royal Vic Hospital since '97. She will be talking about fatigue as a result of chemotherapy or radiotherapy, and talk about the ways of minimizing the effects of fatigue. We also have Dr. Diane Provencher, who is an oncological gynecologist at the Centre Hospitalier de l'Université de Montréal, and she'll be talking about the chemo brain effects, which, due to research, this concern is beginning to look more closely at this secondary effect of chemotherapy. So I turn the microphone over to Christine Leblanc. Good afternoon. I'm going to talk to you today about fatigue. And when we talk about fatigue, which is related to the treatment of cancer or to a cancer diagnostic, we're not talking about the same fatigue that I've been doing something and I'm tired now. We're talking about a much more intense fatigue. This is a type of fatigue that somebody who's suffering from cancer can feel even after a good night's sleep. We can get up in the morning and we're okay usually, and we can take up our activities and everything's okay. However, for people who are suffering from cancer, even if they rest several times during the day, even if they have good periods of sleep, the fatigue remains present. It's something that we're stuck with, and it's not to say that it was not something we can get rid of, but we're something that we can't overcome. The image that I have in my mind is that something that's difficult to present over the phone, a little 2-year-old who's on the tile and is so tired that she falls asleep. And this is a little bit like that sometimes with the patients that I work with. So what I'd like to say here today is that when you tell us people that are going through chemotherapy and that suffer from cancer, I understand that it's not the same fatigue as people that are around us. I don't know whether this is reassuring for you, but we know that there are some things that we can do about it. This comes mainly from the diagnostic, from the tumor itself, which uses up energy. It can come from the treatment itself, from chemotherapy or radiotherapy or combinations of both. It can come, that because of the treatments that there can be anemia, effect on the red cells, which decrease. There can be deficiency in iron levels, different vitamins like B12 or folate, and this can also, if this disease is quite advanced, there can be the effect of the bone into the bone marrow by the disease, and then we can have again a decrease in red cells. And sometimes we can see bleeding, particularly in the cases of gynecological cancers. This is something that is going to weaken the patient. There can also be hormonal problems, hypothyroidism, and with the type of treatments that we give you, often people have less appetite, so malnutrition can also have an impact so that they eat snacks rather than meals, and so that all the different nutritious elements are absent. So chemotherapy as well. I'm going to slow down a bit. This can also change his taste as a result of chemotherapy. Things taste metallic. They don't taste the same. food doesn't taste the same. So people don't feel like necessarily like eating what's served. You can also be nauseous due to the different treatments. The fear of vomiting can sometimes, when we put anything in our mouth, there's no stimulus to eat properly. And so that these are different things that can change the taste. And as if you have the impression that you're living on pills and you don't have any room for the food. Sometimes what we can see is due to the diagnostics and the treatment, they can see more mood disorders. You can attitude. People are a bit depressed and feeling negative. And all of this together, it's not just one particular factor that we could put a finger on. It's not just a matter of eating well. If we tell the patient there are a number of factors involved, it's very multi-factor, so that we have to approach it in this way. And of course, there are different types of medication that we can use to stimulate blood cell production or after chemotherapy. We know of different things that can be used. For example, exercise. Any oncologist or oncology nurses will tell you that very important is how can you, I'm tired, everything is difficult to do, so how can I wash myself and because I'm too tired to do these things. And we know that it's less we do, it's like a vicious cycle, less we'll be able to do. I would say that it's important to have a balance in all of this. Balanced nutrition, our energies, so that we can be able to carry out activities so that we will generate more energy, so that we will be able to go and train in a gym few times a week, to have sustained activity, perhaps 20, 30 minutes. And there are other people who just taking a walk several times a day, and that will be enough. Now you need to see what you can do without looking, just contemplating your navel and saying, I'm too tired to do anything. The more we do, the more energy we'll have, because this releases happy hormones, the joy hormones, which are secreted when we carry out physical activity.